So the Burlington OHT was one of the initial OHTs to receive approval in 2019 to become an OHT. In late 2023, the Burlington Ontario Health Team was identified as one of the accelerated I-12 OHTs, and this means that they will be just like given more resources to provide a little bit more care. And the first thing that the OHTs were required to work on is actually creating integrated clinical pathways for two chronic conditions, COPD and heart failure. A little bit before that, maybe a year and a half, some of the OHTs were piloted to work on integrated clinical pathways for COPD and heart failure. However, the Burlington OHT was not one of them. So last year, this was our very first experience to work on any clinical pathways. Our approach within the Burlington OHT to design any new initiatives is actually co-designing. And when we say co-designing, we include the majority of the stakeholders in our community, as well as patients and caregivers. The goal was to create integrated care pathways that will look at the entire disease trajectory. So thinking about prevention and early detection all the way until palliation. Also, we were interested in looking at ways to facilitate care across various health and social care settings. So paying attention to social terms of health was also a priority. What we did during this extensive community engagement, we spoke with about 70 key informants representing providers and provider organizations, as well as patients and caregivers. And we conducted about 100 hours of engagement. It's important to note that some of these activities, the engagement activities, were co-facilitated with two other OHTs, the Greater Hamilton Health Network, as well as Middlesex London OHTs, who were tasked by the same task of creating clinical pathways for COPD and heart failure. And we do have some pre-existing relationships with them in terms of working together. And also, the three of us belong to Ontario Health West in terms of geography. The outcome of the engagement work was actually understanding what are the guiding principles we were thinking about co-designing and implementing pathways for COPD and heart failure. For us, we decided that we are building care pathways and not clinical pathways, and I'm going to come to this in a minute. Also, our pathways are person-centered, evidence-based, standardized, yet adaptable, provider-friendly, and we are targeting all individuals, not the top of the pyramid of the population health. And we are trying to co-design pathways that are easy to adapt by our providers, equitable, and sustainable. So how do we view our care pathways, and why did we decide to create care pathways and not clinical pathways? So for us, a care pathway focuses on the majority, if not all, of the individuals living with a chronic disease, rather than focusing on a segment or two. And also, a care pathway would pay special attention to upstream interventions, so thinking about prevention, early detection, as well as management. And also, a care pathway would be addressing clinical and non-clinical needs of individuals living with a particular chronic condition, and it recognizes the intersection between different chronic disease, as well as physical, psychological, and mental factors that would affect the outcomes of these chronic conditions. The other findings, other than the importance of looking at a care pathway other than a clinical pathway, so our stakeholders identified that we do have so many programs that are already existing within our community. However, they're still silent, and the awareness about them is very challenging, whether to our providers or patients. So there was a request to, can we please have all these programs listed somewhere? Also, our primary care providers said that they lack access to consistent evidence-based resources. And by that, they meant that there are quality standards out there. Sometimes they check it, but it's not easy for them to check the quality standards with each and every patient. So is there a way to make this easier? Also, whenever there is a change in the quality standards, most of the time they don't get updated about that. So how can we help them get the most recent and updated data that would support the management of their patients? Also, coordination across different settings was a big gap. and the supports that are needed to promote self-management and patient education as active partners in the management of chronic disease was a big gap. For us, in order to put all these findings together, our ultimate goal was to create an integrated system for chronic disease prevention and management. And for that, you can think about two distinctive components. A digital enabler that would support our providers in terms of the knowledge awareness, listing of the programs, how to do referrals, eligibility criteria, when and where and how to refer the patients, as well as an interdisciplinary team that would include all the functions that are lacking within an integrated care system that is currently in place. So as mentioned by our stakeholders, there are so many siloed interventions. So for instance, there are remote care management programs, but does everyone knows about them? And do they accept everyone? No. System navigation, both for providers and patients. There are some buckets in our community that do amazing system navigation, but it's not for everyone. And also there was a need to think about how to increase the capacity of all the community services that are serving individuals living with chronic disease. But the most interesting piece was about how to put all this within a system that would be efficient and sustainable. And for that, I will leave you with Abhi Regmi, my colleague.
So as Reham mentioned, we got into the engagement phases with our partners in the West here with Middlesex London and Greater Hamilton Health Network OHTs. And through that collaboration, a decision was made to enter an RFP process together as well, having all the findings that Reham just explained. Through our engagements, we put together a pretty robust requirements document, evaluation criteria, and then we entered a RFP process to find a solution, a digital solution that would check most, if not all, the boxes that we're looking for. And we successfully went through that process and did identify health pathways as the winner of obviously the RFP process, and that is the platform that we're using to house our or to build our care pathways with. Each pathway within this health pathways platform have clear and concise steps for assessing, managing, and referring patients. And really, it is a provider-facing solution that is designed to be used at the point of care for primary care providers, which will include family physicians, NPs, and allied health professionals also. And then for the implementation of health pathways, as a tri-OHT team, we've really come together to collaborate on this solution and implementation. So we have a collaborative governance table. We have a pathway selection methodology and a table. These are all kind of work streams that we've established for successful implementation. And obviously, integral part of that being communications and engagement, and also a very robust evaluation plan that has been put in place right from the very beginning. Okay, so we talked so much about collaboration, and really it has been a collaboration across the tri-OHT team, as well as the health pathway. In choosing health pathways as a solution, one of the main benefits of this platform is that when we're looking at developing these pathways, there are existing pathways already on the platform, about 600 plus pathways that are already existing that have been used in New Zealand and Wales and across parts of Australia and other parts of the United Kingdom. And to draw from that pool of already existing care pathways and to be able to localize that to our context was one of the things that really attracted us to this platform. So this allows for looking at the content and really necessitating conversations between the primary care and secondary care, and come to an agreement, a bit of a local agreement that this is how we're going to do things around here. So, in taking an existing pathway, in enabling those conversations between our primary and secondary care providers, and in arriving at a common way to do things around here is what is really meant excessive collaboration across all of those levels. Doctors and other health professionals with experience in the pathway are involved in compiling and adapting content. So when we're talking about localization, we have clinical editors who are family physicians in the community already working, actually writing these pathways or revising also. And then we've got a technical writing team from Health Pathways that are supporting with the design and writing as well. So our goal for June of 2025 is to have 40 to 50 care pathways that are going to be reviewed, localized, and published to our region by June of 2025. So just real quick on the value proposition of the Health Pathways platform. Again, easy to use. It's used for designed for point of care. It's a single access point for the single access point. It ensures simplified access to clinical guidance in real time. Really saving time for our primary care physicians on having to go to multiple places to look for this information, because not only does it house clinical guidance, it also has resources that are, and with referral pages, referral forms, etc., all in one place, and also patient education resources. So it really is a one-stop shop for our providers, and it really continues to foster collaboration across specialties, allowing more coordinated care and greater options, and obviously as a result of that, reducing variations in care. So yeah, so we're in development. This is kind of a preview of what our pathways page will look like for the providers. Burlington Community Health Pathways, as you can see, it's still under construction, but this is a view of our draft page. Yeah, and then we wanna leave you with some take-home messages really from the engagement, from the work that we're doing of Health Pathways implementation. The biggest one being here, engagement. We can't stress enough how that's been so important in all aspects of our community, from the provider as well as patients, as well as leadership within the various organizations that represent the healthcare system. Engage as much as you can. And then implementing, best practices within integrated care requires obviously tweaking, tailoring, and adaptation. And our collaborative approaches among integrated care networks can facilitate innovation and forward thinking. So we're seeing that, as a result of all of these conversations that are going on between our specialists and our primary care providers when we're developing the pathways. Oh yeah, so just leaving you with our contact if you need to reach us at any point. Thank you so much.